Osteoarthritis, the wear and tear of knee joint, is a very common joint problem affecting millions of people around the world. This condition, in its extreme end, results in a need for a knee replacement surgery. Though a successful surgery, the current trend is to save and preserve the joint and postpone the surgery as far as possible. In this video, we will see how an offloading knee brace helps us in the management of knee pain. The wear and tear of the knee often starts in the inner compartment of the knee, known as medial joint. The compartment is affected early, as in many normal individuals, more weight gets transmitted on the medial or the inner side of the knee. It is much more common in people who have a bow-leg deformity of the knee, who take more weight on the inner compartment of the knee. The osteoarthritis gradually worsens with progressive increase in pain, but there are many exacerbations of sudden acute pain which could disable the patient. These exacerbations are often due to a meniscus tear. The meniscus, as you may know, is a shock absorber of the knee. In an overloaded and worn out knee, they can get crushed and torn, reducing pain. The most severe injury of the meniscus is a root tear, in which the attachment of the meniscus is torn at the back. This injury results in an extrusion of meniscus out of the joint and a total loss of supportive function of the meniscus. This leads to a concentration of forces in focal areas of bone, resulting in injury to the trabecular architecture of the sponge bone. This results in a bone marrow edema and stress fracture. This is seen as bright signal areas in MRI scans called bone marrow lesions. While the meniscus root tears need a keyhole surgery to repair, in many instances the bone marrow lesions heal when the knee is given rest and supportive medications. This is a video of a patient who was advised a total knee replacement back in 2013. While reviewing the MRI of this patient, we found a sonk lesion, a bone marrow lesion, which was treated just with unloading the knee by giving rest, using a walker support for walking and supportive medications. This patient recovered well, and this is the amount of function she has in 2019. And this indicates that bone marrow lesions and the knee pain in osteoarthritis can be alleviated by the use of offloading the knee for a while, giving rest to the knee, allowing a chance for the knee to heal by itself. The deleterious effects of medial compartment overloading can be reduced by the use of a special type of knee brace called offloading brace. These braces have hinges which help us to adjust the alignment of the lower limb. They open up the damaged inner compartment and redistribute the load to the relatively normal outer lateral compartment. We prescribe offloading braces in these following conditions. Number 1, to offload the knee in the presence of a bone marrow lesion or a sonk lesion. Number 2, to protect the knee following a meniscus repair, meniscus root repair, or a cartilage repair in the inner compartment of the knee. To reduce pain in day-to-day activities with patients who have a mild to moderate wear and tear of the knee. And number 4, in young patients who have knee pain along with a bow leg, usually a bony corrective surgery called high tibial osteotomy is advised. Before the surgery, sometimes we prescribe an offloading knee brace to this patient and look for the improvement in knee pain. If the patient shows good improvement in the knee pain, we can be assured of a good success following the surgical procedure. On the downside, patients may find it difficult to wear the knee brace for a long period of time. Some can experience pain and irritation following fitting of the knee brace, and in people with large thighs, fitting the brace could be a challenge. To conclude, offloading braces are helpful in tiding over the painful crisis in knee osteoarthritis. They can prevent pain if used selectively for high demand activities, and also they are very useful to protect the knee after knee preserving joint surgeries. In our opinion, knee braces cannot be prescribed for everybody but they can be extremely helpful if you can find the suitable candidate for the knee brace, and you can get an extremely rewarding result following these uses of the device. Thank you very much.